Now, menstrual health remains a major topic of concern. Over 80% of female pupils are estimated to have no access to menstrual hygiene products, either at school or at home. The Team Free Sanitary Pads organization is calling for a menstrual health and hygiene management bill, which aims to end what it calls period poverty. To speak more about this and their work, we are joined by founder and activist Nokuzola Ndwandwe, who joins us now virtually. Thank you so much for your time, Nokuzola. Such a great initiative, such an important one. Tell me about the importance of this and the work that you're trying to do in basically allowing these young girls to have access to sanitary pads.
Thank you so much, Heidi, for having me on the show. The call for the Menstrual Health Rights Bill and Law is a very important call because our aim is to ensure that women and young girls have access to career advancement opportunities and have access to quality education without being hindered by a natural biological process, which is access to menstrual products. And also, we need to take into account the fact that while we do have the sanitary dignity implementation framework in place, however, it's not legally binding. We need to have structural framework, structural laws that actually allow for buy-in from the private sector, from civil society, and also allows for accountability across multi-sectorial accountability across all sectors and across all socioeconomic spheres. So in essence, we want to eradicate the VAT scrap on all menstrual products to protect the human rights of all menstruators, all women and young girls in the country, so that we can have access to quality education and career advancement opportunities.
But you would wonder, and maybe this can be the question to you, why this is not done already, why it's taking so long for government to allow this to happen, for government to allow for young girls and women to have access to sanitary pads. You know, it's just mind-boggling that this is not happening, and you have young girls and women, you know, basically losing their dignity because they're unable to live a normal life because of this period poverty that they experience.
Absolutely, Heidi. I think one of the issues is the fact that capacity is an issue. I mean, we can't be operating in silos. We can't be having the government operating on its own in terms of fighting period poverty, and then not having the private sector play its part in terms of assisting with the financing. Because, I mean, having legislation and having policy structures in place is not enough when you don't have a budget to actually allocate so that women and young girls across all socioeconomic spheres have access to period products. Particularly because we also need policies in the workspaces as well, where women have access to paid menstrual leave, where they're able to take care of their needs in terms of any chronic illnesses that are related to menstrual health and hygiene management. So I think it needs more collaborative efforts. It needs efforts from the private sector as well, prioritizing women and young girls, prioritizing women-led businesses, prioritizing quality menstrual products in public spaces and across all socioeconomic spheres. So I think we need to push for capacity. We need to come together as a society, as members of parliament, as NGOs and other organizations dedicated to gender equality, and actually work together and ensure that South Africa has a menstrual health rights bill and law. And I think the leadership structure at the top, governance, we need to ensure that there's accountability from government structures as well as the private sector, so that the implementation of the existing policies over and above our calls for a menstrual health rights bill and law are actually realized and they become reality, and that the beneficiaries on the ground actually benefit.
Just lastly, Nokuzola, I want to ask you about your engagement with government, because obviously you need to work hand in hand with them and to try and get them to understand the importance of this. Has it been forthcoming, and do you think we are ever going to see the end of, you know, period poverty as you've described it?
So far, our engagement with the South African government has been very much it's just based on us as activists coming forward, making our viewpoints heard with the South African government, and actually being able to see the transparency as to how things work, where the money is going in terms of the budget that we fought for in 2018, where the South African government committed to setting aside 157 million and continues to set aside an incremental amount of budget allocation towards free menstrual products, but particularly, targeting schools and tertiary institutions. But we also want to widen the scope of the sanitary dignity implementation framework, which is why we're calling for a menstrual health rights bill and law for sustainability in the foreseeable future, for future governments to be able to implement and have a structure in place whereby we're able to see eradication of period poverty once and for all. I mean, if you have the condom supply model where condoms are freely accessible across all public spaces and socioeconomic spheres, then I think we'll be able to eradicate period poverty if you implement a similar model, but also take into account the fact that the unique experiences of all menstruators, young girls and women in workspaces and in tertiary institutions and across all socioeconomic spheres. So I think if we all come together on board and we all pull in our knowledge in terms of researchers coming on board as well, academics, leaders in the private sector coming on board, I think we'll be able to eradicate period poverty in a very structural, structural and transparent manner, which holds everyone accountable in terms of eradicating period poverty.
Yes, and sorry, you just touched on something very important about the condom supply, and I think that's what we're all looking at, going, if you can supply condoms, why can't you supply sanitary pads to those in desperate need?
Absolutely. I mean, we have manufacturing plants for condom supply. We could also have manufacturing plants for essentials around menstrual health and hygiene management, which could have a positive effect on the economy. I mean, once we have manufacturing plants in South Africa and we provide quality menstrual products, then we'll be able to eradicate period poverty and also empower women, women-led businesses, and also eradicate unemployment. And we know that the majority of the unemployed are women. So I think if you want to eradicate period poverty and achieve gender equality by 2030, we need to look at a very holistic approach whereby we don't look at menstrual health and hygiene management as just a distribution of menstrual products. We look at menstrual health education. We look at ways in which we could actually eradicate various poverty issues that are related to menstrual health and hygiene management.
Yes, certainly. Well, let's just hope something is done about this, because it's such an important initiative. And thank you for the work that you do and the pressure that you are putting on government. That was Nokuzola Ndwandwe, who's the founder of Team Free Sanitary Pads. Isn't it just bizarre? I mean, condoms are absolutely free, but, you know, you have to pay for sanitary pads, and people in desperate need can't go to school because of this. It's mind-boggling, and hopefully something will urgently be done about this, because you have young girls who have lost their dignity because they cannot go to school because they just don't have sanitary pads. It's shocking that we live like this in 2023.